Hi, everyone. Firstly, thank you for the opportunity to be part of this esteemed panel. It's been really gratifying over the last couple of weeks to think about how we would come together to talk about where we sit in this respective area of advancing public-private partnerships and what that means for various sectors. So what I'm going to be talking about is the effects of a potential transportation solution and the test of that on impaired driving in one of the communities that we are supporting around the world. So before I start, the harmful use of alcohol is a global problem. The UN and the WHO have, of course, recognized the harmful alcohol use as having a great impact and of a leading risk factor for non-communicable diseases around the world. We know in urban areas this issue might also be even more acute, and the UN has recognized in order to address this issue, public-private partnership is possible. So in response to this call for a public-private partnership and for the reduction of harmful drinking, AB InBev, the world's largest brewer, in December of 2015 launched 4 global smart drinking goals. So these 4 global smart drinking goals have a focus on creating a new norm around smart drinking. So creating a culture where harmful drinking is culturally unacceptable. And their strategy is twofold. One is to do it inside the actual corporation through changing its portfolio from low to no alcohol products, 20% of it representing their portfolio by 2025, to changing its labeling practices so that they can potentially increase alcohol health literacy, to changing how it engages in its marketing practices so that they are focused more on changing behavior. And they've also committed to doing this in another way, which is committing to a reduction of harmful drinking in 6 cities around the world and doing that by 10% by 2020. In order to add rigor to this very ambitious set of targets, the company decided to create the AB InBev Foundation, where I sit. In 2017, we became operational to help strengthen the achievement of these very ambitious goals. So the AB InBev Foundation's mission is to accelerate the reduction of harmful drinking, specifically in 6 cities around the world. The geographies where we're working is quite diverse, as you can see on this map here. And we are focused on doing this through 2 strategies that are overlapping. The first is by testing a model of public-private partnership and collaboration where multiple stakeholders, including the alcohol industry, come together to find solutions to address harmful drinking in their community. The other that we support at ABIF is evidence-based programs and practices to achieve that objective and to support the evaluation and sharing of all of the learnings that come out of these communities. So what I'm going to focus on today is focus in on the city pilot of Columbus, Ohio, given that the topic here is around transportation. And they've been exploring a really interesting innovation around rideshare programs in that community. So to give a little bit of context of what this program looks like in Columbus, the steering committee or community coalition was launched in late 2016. There are currently 6 different groups of members who are part of this coalition who represent universities, government, and the private sector. So when they first launched in 2016, they were interested in looking at how a safe ride program could potentially be used to address impaired driving in their community. And this was a really interesting opportunity at the time for a few reasons. One is the research base currently around safe ride programs is quite mixed. The methodologies that have been used and the results have not been consistent. So there was an opportunity to explore further this knowledge gap and the utility of these kinds of programs. This program was also of interest, and I think it's maybe even of more interest, because of the opportunity, increased interest in urban areas around the world where there's great popularity in these kinds of programs, and the opportunity to explore whether or not these kinds of options or technological solutions, if you will, could actually be used to reduce impaired driving. So the Columbus community decided to test whether or not this was a possibility. So in terms of the intervention design, so the intervention was designed as such. It had two key components and then a component to help reinforce some of the messaging. The first is that round-trip coupons were made available and delivered online, as well as at high-risk drinking areas, to offer safe rides home to people around in the community of Columbus. The other part of the intervention was increased enforcement in the community, and this increased enforcement was both in high-risk areas as well as at high-risk times. So, for example, on weekends when there was a football occasion is a time where this kind of enforcement would be increased. In addition to that, there was significant publicity on television and radio coverage, kind of promoting that this program existed to see whether or not this would have an effect and if people would be consuming this. So we saw this as a very interesting opportunity and, of course, wanted to be able to support an evaluation of what we could learn from this community. So the intervention period was about 3 months. We supported a group called HBSA, which is a supporting organization of the Pacific Institute for Research and Evaluation, to do an evaluation of this program. And this evaluation included 3 main parts to it. One, it included an intercept survey so that they could actually pick up the typical kinds of people who are spending times in hospitality zones to kind of help reduce selection bias in the sample. They also did a survey of Safe Ride users over 5 different weekends post-intervention. So if the intervention was typically on weekends, they would do a survey on Mondays after the intervention took place. And then luckily, because the partnership with Lyft, they offered to provide some actual usage data to actually include that as part of the evaluation design. What was also interesting as part of this evaluation is that they were able to do some cost-effectiveness analyses around it, which I think is quite important given that this is a very new area and the popularity of these kinds of programs. So what are the preliminary findings? So the findings are interesting, and these are high level. The evaluation team shared this with the community to inform future programming and commitments for this kind of intervention, and it's now being subject to peer review. But ultimately, the results were mixed. So they found that people who actually were part of this program self-reported that they were less likely to drive while impaired. So the expectation around, these kinds of interventions and why there's been, this has been viewed as an opportunity in communities in some ways was at least initially validated in these preliminary results. However, it also led to an increase in drinking, an average of about 1 additional drink per recipient. And questions were raised about the benefit cost of this intervention as well. So we see this as an incredible opportunity for the community to reflect on what does this mean for you. So over the next few months, we're going to be supporting a convening because we believe that passive support of results is not enough. But we have this opportunity with this community coalition in Columbus for them to look both as individual stakeholders in their program, but also as a coalition on what this means for them. So we'll have more to share when that happens. But we're excited about this convening, but also how this might be contributing to this new body of knowledge about the utility of these kinds of programs and the opportunity it may present for addressing impaired driving, but also thinking about what it means for longer-term public health promotion goals. So this is just an example of one intervention that was supported a few years ago. As I mentioned, we're supporting initiatives in 6 cities around the world. We're funding some of those efforts, but the government is also bringing resources to the table, as well as AB InBev as a company and other actors. So we're seeing diverse kinds of interventions that are taking place, from screening and brief intervention to increased enforcement of existing and support for new policy changes, to exploring opportunities for addressing violence in the communities. And so over the next couple of years, we look forward to having the opportunity to share what we've learned in these very diverse parts of the world.